Hello, my name is Heather Thomas, and this is my conceptual video number 1. I'm going to discuss chapters 3 and 5 in our MHI 583 class. I'm going to start with chapter 3, which chapter 3 discusses the DIKW acronym, which means Data, Information, and Knowledge. And basically, I'll start with data. Data are values, and the most common types of data systems are numeric, string, and Boolean. The numeric element is basically data that's measured by a number in one form or another. The number can be an integer, floating point, or a fixed point. An integer is a whole number with no decimal point, and the floating and fixing points, have digits to the right of the decimal point. So the most significant part of the integer would be the first three digits, like 3.71 would be the example. And strings are elements that contain alphanumeric data and numbers. So it could be like text data. The Boolean system is basically when the system uses a 1 and a 0, and 1 means true and 0 means false. So basically, a 1 can say if is the patient inpatient, and you would put 1 for true. So types of healthcare data will be found in nurses' notes, PT records, imaging, and everything else that is contained within a patient's medical records. Applications that handle this type of data are the EHR, the LIS, which is Laboratory Information Systems, the RAS, Radiology Information Systems, the PAC system, and the Business and Financial Systems. All of these type of programs handle the data that I'm discussing. Now, data can lead into problems when it is incorrect or corrupt. For instance, if something is put in the wrong field, it could lead into not giving the patient's medical history. Basically, the patient's medical history could be incorrect. And this could really lead into problems with medical and prescription errors for the physicians if they don't know, for instance, that they're on a certain medication. So it's really imperative to make sure or try to ensure that the data is being entered correctly. So the next thing I'm going to discuss is the information, and basically the information is the data is information. For instance, an MRI imaging, the pixels of the MRI would be considered the data of the MRI, but the MRI itself, the image itself, would be considered the information. So incorrect information can also be very problematic for our patients, could lead into serious prescription and medical errors. Knowledge is the last part of that concept, the DIKW concept, and knowledge is basically an organization of the data and information together, and this aids the healthcare providers in making future medical decisions. Data can come from physician experience, their education, their continuing education, databases, and guidelines. And one thing that wasn't mentioned in the book, but it's pretty valid today, is evidence-based medicine that the physicians use very often. And I have a quote regarding that. The quote says, EBM, which is evidence-based medicine, demands better evidence than has traditionally been used. And this is from Evidence-Based Medicine, New Approaches and Challenges, and the author is Mosaic and others, and that was in 2008. Okay, next I'm going to go on to Chapter 5. And Chapter 5 focuses on adoption and the use of clinical systems utilizing policies, laws, regulations, contracts, and procedures. We're going to start with policies. This is another quote. Policies are created to realize specific economic or healthcare goals. And this quote is from our textbook, which is Essentials of Clinical Information from Fries and Mitsoulis in 2019. Um, Policies are implemented based on the goals and the values of a healthcare organization. The policies are not laws, but they are derivative of regulatory action. So next, I'm going to talk about the laws, and laws can be state or federal, mandated by the state or federal government. The state would deal with laws like patient privacy and public health, and then the federal government is a little, their laws are a little more intense. For instance, the HIPAA laws, which protect patient privacy, or the ACA laws that mandates all adults carry and maintain health insurance. If they do not carry and maintain health insurance, they will be penalized. Okay, next are regulations, and regulations can be federal or state, and they are, and this is another quote, they mandate one or more executive agencies to act on laws by specific times. That is also from our textbook, Essentials of Clinical Information, Fries and Mazzoulis, 2019. Regulations are, I apologize. Federal and state laws have different regulations for HCOs to follow. Contracts pertain to an HCO's healthcare organization working together to achieve a policy goal. If regulations and or contracts are not adhered to in a healthcare organization, that organization can face high penalties. Now, procedures is basically what bring policies and contracts together, the requirements together. Procedures are highly vital to an HCO. Without following procedures, it could basically cause the HCO to fail. So it is very imperative to the board members and the higher ups to ensure that all of their healthcare staff are very versed in all the procedures and what they're expected to do. Okay, so basically, if HCO could be liable for not following procedures, it could face very costly litigations and lengthy litigations. Okay, so in conclusion, Chapter 3 talks about data, information, and knowledge, which make up the inner workings of the healthcare organization. Without the DIKW, HCOs would not be as advanced as they are today. Chapter 5 discusses policy, laws, regulations, contracts, and procedures, which are essentially put into place to ensure that patients are receiving the highest quality of care possible, which includes their safety, their privacy, and their level of care. Thank you very much.